10 benefits of a keto diet. The ketogenic diet, also known as the keto diet, has grown in popularity in recent years. A keto diet is one that consists of a low carbohydrate, high fat, and high protein diet. The diet, like many others, has sparked debate. However, numerous studies have shown that this eating pattern has advantages. The diet typically allows for 75% fat, 20% protein, and 5% carbohydrates. This is in stark contrast to the American diet, which gets 50 to 60% of its calories from carbohydrates. The diet's premise is that by depriving your body of glucose, it will be forced to burn its fat reserves for energy. Benefit number 1: weight loss. Weight loss is one of the reasons people choose the keto diet. Initially, weight loss is caused by a loss of water. This is due to the fact that when you reduce your carbohydrate intake, your body uses up the carbohydrates stored in the liver, which hold on to water. Because it encourages you to eat whole foods and satisfying healthy fats, the diet results in additional weight loss. By reducing carbs, you will also reduce sugar, resulting in a more consistent supply of energy, no more sugar highs and crashes. In studies that compared low-carb and low-fat diets, people who restricted their carbs lost 2 to 3 times as much weight without feeling hungry. Benefit number 2: reduces appetite. One of the benefits of the keto diet that many people report is an increase in energy and a decreased desire to snack all the time. According to research, the keto diet causes fewer hunger pangs and a decreased desire to eat. This is a significant advantage of the keto diet, especially when compared to other diets that cause people to feel hungry and even miserable all of the time, which is why diets frequently fail to work for people. This benefit is also related to why people lose weight. A decrease in appetite means a reduction in calories. Benefit number 3: great amount of fat loss from the abdominal cavity. Many of us are aware that losing weight around the abdominal cavity is difficult. And because spot training does not result in fat loss in a specific area, many of us are left with excess fat around our bellies. Fat is classified into 2 types: visceral fat, which surrounds our organs and the abdominal cavity, and subcutaneous fat, which is fat beneath the skin. Excess fat storage can have a negative impact on health and increase the risk of disease. Excess abdominal fat, for example, has been linked to diabetes and hyperlipidemia. Low-carb diets are extremely effective at reducing this dangerous abdominal fat. In fact, it appears that a greater proportion of the fat lost on low-carb diets comes from the abdominal cavity. Benefit number 4: triglycerides decrease drastically. Despite the fact that this diet is high in fat, triglyceride levels in the body decrease significantly. Triglycerides are fat molecules that circulate throughout our bodies. A high circulating triglyceride level has been linked to heart disease, metabolic syndromes, and diabetes. As a result, having a stable level is extremely beneficial in order to avoid disease. Overconsumption of carbohydrates is a common cause of high triglyceride levels. As a result, cutting out carbs leads to a decrease in triglycerides. Low-fat diets, on the other hand, frequently cause an increase in triglycerides. A study conducted by a UC Berkeley research team backs this up. When student participants increased their carbohydrate intake while decreasing their fat intake, their triglyceride levels rose. Benefit number 5: increased levels of good HDL cholesterol. Lipoproteins come in a variety of forms in the body. The 2 most common are HDL, high-density lipoprotein, and LDL, low-density lipoprotein. HDL is in charge of collecting triglycerides and returning them to the liver. LDL, on the other hand, transports triglycerides from the liver to the body. A high LDL level can cause artery hardening. This can result in heart disease. Eating fat is one of the best ways to boost good HDL levels, and low-carb diets are high in fat. As a result, it's not surprising that HDL levels rise dramatically on healthy, low-carb diets, whereas they rise only moderately or even fall on low-fat diets. Benefit number 6: reduced blood sugar levels. Ketogenic diets, or low-carb diets, can also be beneficial for people suffering from diabetes and insulin resistance, both of which affect millions of people worldwide. Cutting carbs significantly lowers blood sugar and insulin levels, according to studies. Some diabetics who start a low-carb diet may need to reduce their insulin dosage by half almost immediately. In one study, 95% of people with type 2 diabetes reduced or eliminated their glucose-lowering medication within 6 months. If you take blood sugar medication, consult your doctor before changing your carbohydrate intake, as your dosage may need to be adjusted to prevent hypoglycemia. Benefit number 7, therapeutic against brain disorders. The keto diet was developed to help children with epilepsy. This started in the 1920s. As a result, the diet has been around for several decades. In many cases, this diet can cure epilepsy in children. In one study, more than half of the children on a keto diet reduced their number of seizures by more than half, and 16% became seizure-free. Other brain conditions, such as Alzheimer's and Parkinson's disease, are now being studied using very low-carbon keto diets. Benefit number 8, can help reduce acne. Acne can be extremely damaging to one's self-esteem. Many, if not all, of us have had run-ins with an unsightly pimple. Some of us also suffer from acne, a chronic condition characterized by the appearance of pimples. Acne can be caused by a variety of factors, one of which is diet and blood sugar. A high-carbohydrate diet can alter gut bacteria and cause more dramatic blood sugar fluctuations, both of which can have an impact on skin health. As a result, it's not surprising that a keto diet may reduce some cases of acne by lowering carb intake. Benefit number 9, may help lower blood pressure. High blood pressure can be extremely harmful to one's health. Over 75 million people in the United States currently have high blood pressure. This means that 1 in every 3 people is affected by the condition. High blood pressure can cause heart disease, stroke, and even kidney failure. There are numerous methods for dealing with high blood pressure. The keto diet may be one method of lowering blood pressure. This is due to the fact that low-carbohydrate diets are an extremely effective way to combat high blood pressure. Lowering your blood pressure can also help you fight a variety of diseases. Benefit number 10, effective against metabolic syndrome. Metabolic syndrome, like high blood pressure, is very common in our society. A metabolic syndrome is a group of conditions that occur together, such as high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol or triglyceride levels, increasing your risk of heart disease, stroke, and diabetes. The keto diet may be beneficial in combating metabolic syndrome. This is due to the fact that a low-carbohydrate diet has been linked to a reduction in all 5 of these symptoms.